Hello. Almost all the anti-cancer sessions I run via Skype provide the same unchangeable pattern of cancer development. Cancer is by no means due to chance. First, there's some kind of not very happy childhood. Separation from the parents, conflicts between them, alcohol or violence in the family, insufficient love and insufficient sense of safety, death of someone close and dear. This may also be simply an unhappy personality of the parent, caused by his or her own traumatic childhood. Unhappy children, when they grow up, become unhappy parents and bring up unhappy children, quite unconsciously and without any bad intent. This is just the way it is. It's not genetics that brings about the development of a colon cancer in the grandmother, the mother and the daughter. It is inheriting unhappy personality. In this context, I will add, as this is a recurring issue and very important for obvious reasons, that if the sense of safety of a small child is constantly and seriously threatened, the natural consequence is the development of leukemia or brain tumor. We need to remember, children are extremely sensitive to the emotions in their surroundings and cannot be deceived in this respect. Bad emotions can even kill them. The latter part of the cancer development pattern refers to adult life. At some point something traumatic happens that leaves us out of balance for a long time. This can be an acute conflict with the spouse, a betrayal, a serious illness, an accident or death of a loved person, the loss of job. We feel overwhelmed by the situation and cannot see any way out. This is actually depression. Several months later, a tumor appears. Depending on the type of trauma, in the women it can be located, for example, in the breast, in the ovaries, or in the uterus. In the men, this can be respectively a lung, a testicle, or a prostate tumor. Does that ring the bell? We all know how much the cancer diagnosis affects the mental state. If additionally the patient happens to be treated by a doctor without moral qualifications for the job, she or he can lose any vital forces left. It is those vital forces that are indispensable for curing the condition. Cancer is depression expressed in the body. Its primary source is in the mind, and it has to be removed from there, just like depression by appropriate psychotherapy. The body, if only it hasn't been excessively damaged, will, as usual, follow the mind, and the tumor will vanish.